So we have here a 77-year-old male patient with a history of an endoscopic resection of an early Barrett's cancer using ESD. Here we can see the gastroesophageal junctions. Here we can nicely see in the center of the endoscopic view the residual non-dysplastic Barrett's epithelium. So we are going to perform argon plasma coagulation now, and for that purpose we use the novel FiAPC probe from Erbe. We have here the novel probe, so it's more or less plug and play. We are using the latest version of the electrosurgical unit, the Erbe VIO 3 generator and the Erbe APC 3 generator. So we choose a pulsedAPC effect 2. I would like to show you the probe and the special design. So you can nicely see that we have here a novel tip design, so it's roundish, and we have a ceramic material of the tip, so that should prevent sticking of the tissue, of the coagulated tissue to the tip of the probe, and of course that should also create a more precise and focused plasma beam that will facilitate a more precise way to coagulate the tissue. So the novel probe is more flexible than the previous one. Could also use the probe in a retroflexed way. So you can see it's easily inserted also in this retroflexed position of the scope. I use here the long distance hood to straighten the tissue, to expose the target tissue, stay away from the tissue here, and then activate coagulation. This is very nice and it's quite precise. So I do the ablation in a longitudinal fashion, starting from distal, going to proximal here. Although we see all the movement in the GE junction, you can easily see that we don't have any sticking tissue at the tip of the probe. So this is very convenient and it's a very important new feature of the novel probe. So it's a very precise way to coagulate here. So here, I think this was this tongue, so I rotate the scope a little bit that we target the next tongue here. And another one on the left-hand side. So I think we have bladed everything. So usually we would have to clean the tip of the probe, but so we see no tissue that sticks to the tip of the probe. So I just pull it back into the working channel, use my transparent cap to remove here the ablated tissue. So as you can see, very effective, no damage of the underlying muscle layer.